Hi, I'm Dr. Anthony Crifase, and thank you so much for taking the time out of your busy day to watch this webinar. In this webinar, you're going to learn my exact strategy on how to recover from thyroid disease naturally without the use of medication or surgery. And this applies to Hashimoto's disease, Graves' disease, and low thyroid, also known as hypothyroidism. Now, I know there are distractions all around us, but this strategy I'm about to share can literally change your life, and I don't want you to miss a single crucial step. So please make a commitment to stay focused. Can you do that for yourself? Close out Facebook, stop checking your email, turn off your cell phone. Just give me your complete attention, because believe me, it will be worth it. And while we will be covering a lot of information, don't worry, because you'll have access to watch this webinar again, and feel free to reach out if you have any additional questions. Now, if you're like most people, you're pretty open-minded and would like a natural solution to your thyroid condition. And I'm gonna take a guess that if you're watching this webinar, you are tired of the same old conventional approach of take this pill for this, take this pill for that model of care, which is essentially a band-aid approach. It's important to understand this distinct difference in the mainstream medical model and a functional medical model that I utilize for all of my clients and patients. My primary focus is to help you find and address the underlying causes to your thyroid condition, by not only assessing your physical and biochemical health, but also your mental and emotional health. You're probably wondering why I'm qualified to teach on this topic. Now, in addition to being a double board certified clinical nutritionist, a doctor of chiropractic medicine, a licensed dietitian nutritionist, a board certified sports nutritionist, and a classically trained chef, trained at Le Cordon Bleu, and many other things, I've helped thousands of people regain their health from not only thyroid disease, but also weight loss, type 2 diabetes, autoimmune disease, and gut issues like irritable bowel syndrome and leaky gut with my customized, unique approach. And nowadays, I even train other practitioners and provide expert consulting to companies on how to do the same. Imagine what your life would be like after you know how to stop losing your hair, have the energy to go to work, school, or even play with your children, lose stubborn weight, be able to eat the foods that you love, and regain youthful skin, hair, and nails. Can you see yourself feeling better and having all the energy in the world? Would that make things better for you? Now, before we dive in, there's some very important limiting belief patterns that I've seen countless people hold on to, and today we need to break them in order for you to fully reap the benefits of this presentation. The first one is I've tried everything. This is a phrase that I've heard over and over again. Many people feel like they've done everything they can to get better. However, within a few short minutes, it becomes very clear that there are still many stones left unturned. When you submit to the thought of having tried everything, you subconsciously submit to the idea that nothing more can be done to help you. So the good news is, I'm gonna show you today that there is a lot that can still be done and a lot that can help you. Now, the second limiting belief pattern is if this worked, my doctor would know about it. You see, mainstream medicine operates out of a completely different paradigm than what I follow, which is called functional medicine. Mainstream medicine focuses on the name of the disease, also known as a diagnosis and a ICD-10 code, and implements a one-size-fits-all approach that centers around symptom management and pharmaceutical drugs. You see, this is fine for acute care or emergency interventions to help you feel better in a traumatic or life-threatening situation. But in long-term chronic care circumstances, treating a disease through symptom management never leads to true healing and often ends up exacerbating the problem. So now that we've covered some important points, let's dive right in. Hey there, and welcome to the webinar on how to conquer thyroid disease without the use of medication or surgeries using this functional medicine approach. Now, again, we're gonna be going over a lot of information here today, so don't worry if you miss something. You can always go back and rewatch this again. Now, I'm gonna move my screen over here so that you can see the entire presentation while I am instructing through it. I'm gonna minimize mine. So before we begin, I'm gonna go over just a little bit about myself, my story, my background, so you understand who I am and why I have helped and how I've helped lots and lots of people with thyroid conditions. So again, my name's Dr. Anthony Crifase, and my story is probably not much different than yours. I actually grew up with a mom who has who was sick for a long time. She had what's known as ALS, or Lou Gehrig's disease. Now, this is a pretty harsh neurodegenerative condition. And I grew up with her. She had it for about 14 or 15 years. And I can tell you that I have seen everything. She had been to every single type of specialist, doctor, healthcare practitioner, alternative medicine practitioner, every single type, you name it. And all I remember is that they threw nothing but drugs at her the entire time. She never had to get surgery for her condition, but all they ever offered her was drugs, very limited laboratory testing, and then prescription medications. And all of it was designed for only symptom management. None of it had gotten to or even attempted to get to the root issue of her problem. Now, fast forward about 9 years, and I'm in school studying, and I started to develop some of my own conditions. Lots of stress from studying, and I was getting rashes on my arms. I was getting fatigue. I was even getting these different food sensitivities that popped out of almost nowhere, unbeknownst to me. After doing some of my own digging and research, I landed upon functional medicine. And at that point in time, the entire puzzle just came together perfectly. The understanding of what my mom went through, the understanding of what I went through. And at that point in time, I started applying this strategy to patients. And what I learned is there was nothing else that came close to this model of care. Getting to the root issues of the person's problem and then addressing them is what clearly solved the issues. So again, here's a little bit of background on me, my story, and hopefully this gives you a little bit of hope that there is so much that can be done for you. If you're struggling with a thyroid condition at this point in time, I want to tell you that I'm here to help you, that you don't need to struggle anymore, that there are far too many women and men in the world struggling with this condition, and we're going to be going over this here today. So my goals for you going forth are, number one, to provide you and to make sure that you understand what a proper diagnosis really looks like for your thyroid condition. Number two is to provide symptomatic relief, but just as important, we want to find and address the underlying causes of your condition. And number four, we want to give you your freedom, your health, and your life back. You should not be living in a situation where you can't go outside and play with your children. You shouldn't be living in a situation where you can't go enjoy time with your friends, where you can't go and have a drink on the beach or take a vacation. And I want to tell you about one of the patients that I had. And she, this was about 6 months ago, and she was a prisoner in her own mind. She had wanted to go out and see her friends. She wanted to go and hike. She hadn't been hiking or working out in months, years actually. And she had been to the top, highest respectable clinics in the world, Mayo Clinic, Duke University, some of these big clinics. And guess what? All she was getting was medications. And the entire time, these doctors are just trying to chase her TSH and T3 numbers with her laboratory work. Again, this model of care, it does not fit for these chronic health conditions. Now, I'm not completely against pharmaceutical interventions by any means. Yes, they do have their place, and many people are actually alive because of prescription and pharmaceutical medications. However, to apply them at the first line of care and then only to base their entire treatment off of that and off of 1 or 2 lab markers is incorrect, and it's going to just be spinning the wheels. So that's what we're going to be going over. Now, here's the common thyroid disease timeline. I'm going to minimize my window just a little bit more so you could see this. So here's the common thyroid disease timeline. People most often start with the thyroid disease, right? It starts developing. Within year 1, you start getting minor symptoms. If you're lucky, you could get worse, okay? And you're lucky if you get a diagnosis in the first year. Again, this is often thyroid disease is often something that festers for years and years until you finally get a diagnosis or a label, so to speak. Year 2, no improvement still. Doctor increases or changes potentially your medication that you're on. This is very, very common for them to change the medication or increase or decrease the dosage because they're trying to make sure that they're hitting the correct marker on the lab. And we're going to cover that today. Now, progress a few years, year 3 to 5. This is where the frustration begins, the sadness about the entire situation, where you start to be told it's all in your head, just keep taking your medication, and your symptoms just continue to worsen. You know, frustration starts to build here, and you're wondering, there has to be some sort of answer out there. There has to be something that can give me some sort of relief. Greater than 5 years, and this can often happen before 5 years, but often this is a timeline, there's extreme frustration. You feel like nobody is listening to you. You've seen dozens of doctors, dozens of specialists, and you're very confused. You're going bouncing from doctor to doctor. You're on multiple different medications. Nobody knows really what's going on. Your symptoms are just completely worsening the entire time. Now, if this has been going on longer than 10 years, chances are the thyroid gland is very dysfunctional. If there's Hashimoto's, it may have been completely worn away at this point. But the disease progression is in full effect, and the fire, so to speak, is completely being fueled at this time. You know, there's many other comorbidities and mortalities that are occurring from stage 1 or the start up until year 10 and more. If you've had a disease for a decade or longer, this is a big problem. And this is when you start to develop other types of conditions. And that could often happen years before, but this is a general timeline here. Now, it's been estimated that about 35% of people actually self-diagnose from online sources. So if you're watching this webinar, chances are that you've done this. You know, that you've gone onto Google or WebMD or another website, and you've been typing in your symptoms because your doctor or your provider, your healthcare practitioner, has not provided you the answers you're looking for. That you're still undiagnosed. Maybe you're undiagnosed, you're misdiagnosed. You're probably confused and frustrated because of these persistent thyroid symptoms, even despite medications and treatments that you've been given. Maybe you've told that your lab tests are normal, even though you continue to have symptoms. And worst of all, you may have been told that there's nothing else that can be done and that you must live with it. Again, I'm going to give you answers to all of these questions that you've been wondering here right now today. So you might be wondering, what is the approach that I take? How can we get to the root issue of your condition and resolve this thyroid problem once and for all? Well, here's the truth. Without doing the proper testing, it's going to be very, very difficult to find out specifically what you are dealing with and what you need to be done. So proper testing is the first and foremost important step. Without the proper testing, we are simply guessing. We're making judgments on what to do based on data, yes, but with the objective quantitative testing that we can get for you, we can specifically identify some of the things such as food and environmental sensitivities. These alone can fuel the massive fire of thyroid disease, autoimmune disease, and the like. We can objectively determine what is going on in the digestive system, which is where 80% or so of your immune system actually lies. And we're going to be covering this further. We can determine how your blood sugar levels are, which is a major body stress. Okay, anemia or blood sugar is related to your insulin and inflammatory levels, which can fuel the fire even further. Balancing the body pH. Your internal homeostasis is known as the internal set mark or set point. And every single part of the body has this perfect just homeostasis. For example, if you veer away from 98.6 degrees Fahrenheit, you might either get a fever or go into hyperthermia. Those are very serious conditions. If your body pH or your blood pH veers out of a certain range, or the specific minerals in your body go out of their specific ranges, you can go into shock and other issues and other conditions that are very traumatic and life-threatening to the body. So balancing the specific pHs of the body is very important as well. Identifying and eliminating some of these toxins, again, whether they're coming from your food, your water, environment, is how we're able to assess what is going on even further. In order to assess the energy production from a cellular perspective, this comes from proper testing as well. It's a basic tenet of biology that cells form tissues, tissues form organs, organs form organ systems, and the organ systems make up the entire body. So if we are starting and looking at health, we have to start from the cellular level because the big picture begins at a cellular level. So we do this by properly testing these markers. We look at the adrenal glands and the hormone axis systems in the body because the hormone axis systems, there are many of them and they actually begin in the brain. And the thyroid adrenal axis system is one of the most important out of the entire body. If there's any heavy metal toxicity, any genetic predispositions, and as well as any other nervous system imbalances, such as an autonomic nervous system imbalance from the parasympathetic to the sympathetic or vice versa, these are very important things that we are address. So this is some of the ways that we're able to conquer and get to the root issue of your condition and then resolve it for you. Now, according to the American Association of Clinical Endocrinologists, 27 million Americans have been diagnosed with thyroid disease. And over 50% of these are said to go undiagnosed. Over 90% are due to the autoimmune disorders. The most common one is called Hashimoto's thyroiditis. And 90% of these 20 million Americans are female. Now, it's expected that females have this thyroid type of condition more than males because of the fluctuating hormones that you deal with more than males. So males that are watching this video, don't worry, we have our own problems, okay? So in this presentation, we're going to be primarily focusing on the hypothyroid condition, also known as Hashimoto's, as that is the most common, or 90% of all thyroid conditions are due to Hashimoto's disease. Now, this 27 million Americans and the 50% undiagnosed, this is what's actually reported, as I believe these numbers are highly, highly much larger than just that. Because what is reported is only what's reported. Many people don't go to the doctor, and thus those statistics are not reported. Now, this is the overall management of what the traditional or mainstream medicine model of treating hypothyroidism looks like. Number one, it looks at only the one of 22 patterns. Now, there are 22 plus patterns of how the thyroid can become dysfunctional. And so the way that traditional medicine looks at it is only through this TSH and T4 feedback loop. You've probably gone to your doctor if you're dealing with thyroid symptoms and they've checked your TSH. And we're going to be covering the specifics of these markers here today. But the problem is that this is one of many, many markers. And this is one marker that's actually produced in the brain. So it's not indicative of what is actually the status in the overall body. So they base everything off of this feedback loop between TSH and T4. And now what they do is, based on those markers alone, they will give you pharmaceuticals for your symptoms. And we're going to go over this further again. And then finally, again, the symptoms of thyroid dysfunction are so far-reaching that you can't just address the thyroid itself, as the body is entirely connected. And as the thyroid, as we'll go over, impacts many different body systems. So just by looking at one or two markers related to the thyroid will not give you a big picture. It will actually very just narrowly scope down what you are trying to address, but won't actually fix any of the problem. Now, traditional medicine, again, can be very fantastic for acute type situations. And while there are necessary times for prescription and pharmaceutical intervention, it should not always be the first line of care, which again is why there's over 27 million Americans dealing with this condition with no answers. So don't expect your traditional or mainstream doctor to necessarily understand, know, or accept what's being presented to you here today, as they are trained in a specific model of care, which again is designed to manage these symptoms, not necessarily designed to get to the root issue. And I want you to think about something, that the United States actually makes up only 5% of the entire world's population, but we consume over 72% of the world's prescription medications. Okay, I'm going to say that once more because this is a shocking statistic if you don't know it already. The United States makes up only 5% of the entire world's population, but the United States consumes over 72% of the world's pharmaceutical medications. Okay, and we are ranked about 78th or 80th in overall longevity. We are not even close to the first. The United States spends billions on healthcare every year, yet chronic diseases continue to rise. People are getting sicker and sicker, and nothing is being done about it. So clearly, if only 5% of the world is consuming over almost 3/4 of the entire prescription medications in the entire world, and we're still a completely dysfunctional and a completely sick country at whole, then something is clearly being done wrong for these types of conditions. And so this is something that needs to be taken from a different point of view, which is what we're going over today for you. Now, the approach that we take via a functional medicine model towards the management of hypothyroid and other thyroid conditions is as follows. We address not only all of the 22 plus patterns of thyroid dysfunction, but we do address all of the other facets of the thyroid pathway and the other areas of the body and organ systems that the thyroid impacts. And we do this starting off by utilizing proper laboratory testing to address these entire body systems. This allows us to get to the root issue of your thyroid condition. Now, lastly, the most important point on this is that this type of approach is not as simple as taking a pill for an ill, right? You've gone to the doctor and here's your medication for this, here's your medication for that. This type of approach is a collaborative effort and does require some lifestyle changes. But when you implement these lifestyle changes, this gets to the root issue and can resolve your condition. So practitioners trained in functional medicine and this type of approach understand that the entire body works together. So it's very, very important that we apply this type of care going forward. Now, the thyroid hormone actually supports many, many different things in the body. Now, your thyroid gland is actually a butterfly-shaped gland that's located in the lower part of your neck. And this is known as the body's internal thermostat. So what does a thermostat do in your home? Well, if you turn the thermostat up, it will increase the heat in your home. Now, when you increase the overall heat somewhere, what will happen? You'll probably get kind of hot. You might start sweating, but most of all, your metabolism will start to increase. So likewise, on the opposite side, if we turn the thermostat down, this could be known as hypo or low thyroid. What this will do is everything will become cold. What happens when you become cold? Everything starts slowing down. Your metabolism slows down. You have slower circulation, etc. And we're going to go over some of these further. But it's important to understand that the thyroid hormone impacts and supports all of these different body areas. Proper stomach acid and digestive function. This is why if you have a thyroid condition, that you might not be digesting food very well. You could have constipation, diarrhea, gas, bloating, heartburn, etc. The immune system, it impacts the immune system highly. So if you have an immune system problem and a thyroid problem, or vice versa, they often go hand in hand, you might catch colds very easily. You might get the flu very often. You might have, be exposed to a virus, and this is going on for months and months and months. The brain and nervous system. The thyroid hormone impacts the brain and nervous system at a cellular level. And we're going to go over this again, but it's everything is very interconnected here, okay? Blood sugar metabolism. The thyroid hormone impacts blood sugar. So if you have been diagnosed with diabetes or insulin dysfunction or pre-diabetes or insulin resistance, this is often correlated. Bone metabolism, sex hormones related to estrogen, progesterone, testosterone. So if our libido is low, if our testosterone is low, all of these things are impacted by the thyroid. Remember, the thyroid is the master regulator of all metabolism. So this kind of sparks the fire for a number of different other body systems in the body. fat burning, as we mentioned, and healthy cholesterol levels. Now, there are three major thyroid conditions as listed here. Number one is hypothyroidism. Now, this may be autoimmune in nature, but it doesn't necessarily mean it is. This is, again, done by specific diagnostic testing. Number two is hyperthyroidism, also known as Graves' disease. This is an autoimmune condition. And number three is Hashimoto's thyroiditis, which is also an autoimmune condition, and we've covered briefly so far. Again, Hashimoto's is responsible for about 90% of all thyroid cases in the United States. Now, here are some symptoms of hypothyroidism and or Hashimoto's disease. Again, we've covered some of these, but take a look at this, and chances are you're probably dealing with at least one, if not many more of these symptoms. Fatigue, weight gain, depression, brain fog. I can't tell you how many people I have worked with that have debilitating fatigue. And when we talk of fatigue, we are talking of you just slept for 8 hours, but you wake up and you are exhausted. You take a shower and you have to go take a 2-hour nap. That is fatigue. It's not that you worked a 10-hour day and you're a little bit tired at the end of the day. That's understandable. This is fatigue. It's debilitating. It weighs you down. It interferes with doing daily lifestyle activities, chores, spending time with your children, with your family, not going out to see friends, anything of the sort. Weight gain. This is another huge one. I can't tell you how many times I've heard, I can't lose the weight. It just won't come off. These are very, very common symptoms of hypothyroid or low thyroid. Depression, brain fog. The thyroid directly impacts the brain. You won't be able to think very well if the thyroid gland is not working properly. Headaches, poor motivation, poor circulation. You might have run into a chair one day and you get a bruise, and that bruise doesn't heal for 30 days or more. That is very poor circulation and poor immune system present right there. Slow healer, again, bloating, acid reflux, poor digestion, constipation. Again, if we slow down the thyroid, this is going to slow down everything in the body, okay? So bloating, acid reflux, poor digestion, constipation, they're all due to poor gastrointestinal or digestive function. Dry hair, brittle nails, hair loss, weak nails. Again, if you are not metabolizing, if you are not breaking down your foods, if you're not overturning cells and utilizing nutrients within the body, you're not going to make and utilize these proteins that you need to make your hair very pretty and soft and smooth and shiny. Your nails will become very frail and brittle. And many, many other things. Your skin will become dry. All of these things are related to poor metabolism and thyroid function. Now, on the other hand, hyperthyroidism and Graves' disease, some of these symptoms can apply to this as well. So again, if we turn up the thermostat, this can become very hot. So if you increase the overall metabolism in the body, you can get things like a fast pulse, insomnia, night sweats, brain fog, headaches, heart palpitations, poor circulation, bloating, nervousness. You can't gain weight. These types of patients can be actually a relatively thin or a normal body type. And this is a problem though. You're still having a lot of different symptoms. Diarrhea, fatigue, emotional. You might even have bulging eyes, which is known as exophthalmos. So with somebody who Graves' disease, their eyes can bulge a little bit. Again, there's specific ways that we're able to get to the root issue of these and find out specifically what you need to resolve the problem. Now, this is a very, very important slide here. So I want you to pay attention to this. Hashimoto's disease can actually give you different types of alternating high and low symptoms. And this is very, very important because Hashimoto's is an autoimmune condition. Now, autoimmune conditions are labeled after the tissue or gland that they are destructing. Okay, so for example, you have an autoimmune condition of the thyroid, such as Hashimoto's thyroiditis. You have multiple sclerosis, which damages the myelin sheath surrounding your nervous system. You have lupus. You have all these other types of autoimmune conditions. But the bottom line is that they will start to attack a specific tissue site. And what happens then is it can start to attack other tissue sites. But it first starts with one tissue that it attacks. Now, here's the thing. If you have Hashimoto's, which is an autoimmune disease, this will start attacking the thyroid. Now, what happens is if it starts attacking the thyroid, this can actually start to release thyroid hormone into the bloodstream. Okay, so now you are releasing excess thyroid hormone into the bloodstream. So now what can happen is you go to your doctor and you are experiencing hyperthyroid symptoms because of the excess thyroid hormone being released into the bloodstream. So your doctor runs your TSH and your T4 and says, wow, it looks like you have hyperthyroidism or potentially Graves' disease. Here's your medication and continue to take it for this long. Now you go home, you start taking this medication, and after a little while, you actually start to, not due to the medication, due to the autoimmune nature of Hashimoto's, you actually start to dip from a hyperthyroid state into a hypothyroid state. So now what happens is with this autoimmune condition, whatever you were doing that was triggering that autoimmune condition before to give you those hyperthyroid or high thyroid symptoms, you stop doing. And all of a sudden you develop a hypothyroid state, or you go into a hypothyroid state. So now you develop hypothyroid symptoms. You're cold, you can't lose weight, you're losing your hair, dry, brittle hair, nails, etc., etc. And you go back to your doctor and you say, I'm having these type of symptoms right now, which the doctor is going to say, scratch his head and say, that's interesting. Now you're having hypothyroid symptoms. Looks like maybe we misdiagnosed you. Here's your medication for hypothyroidism. And now you go home again and you continue to take that. And now what can happen is, again, you even potentially start doing that exact same thing again that's triggering these autoimmune condition, giving you hyperthyroid symptoms. You go back to the doctor and vice versa. Until one point in time, you start damaging the gland so much that you start tilting the scale. Instead of going from fluctuating high and low, it just starts declining from high to low. And then at one point in time, you just only have hypo or low thyroid symptoms because the gland is essentially burned itself out. You don't have it. You're not spilling any more thyroid hormone into the bloodstream anymore. So this is really common, and can't tell you how many people have told me this. Yeah, I started with these types of symptoms. Now I have these types of symptoms. They misdiagnosed me. They diagnosed me with one thing. Now they diagnose me with another. So Hashimoto's, you can have alternating levels of high and low. This can result in combination of high and low thyroid symptoms. Again, Hashimoto's is an autoimmune condition. Now, the autoimmune condition means that this is an immune system problem. It is not just a thyroid problem, which means that if we are only addressing the thyroid gland, if we're only looking at the thyroid gland, that this autoimmune condition can continue to develop and get worse. So we must address the immune system. That is the underlying component of this problem here. Now, you may have gone to your doctor, and chances are they have told you one time or another that your lab test came back normal. Guess what? Everything's great. Your lab test came back normal. You don't have a problem. And you're scratching your head thinking, but I'm still having all these symptoms. And then you get your lab checked 6 months later, and they tell you again, we don't find anything. Just keep taking your medication. That's a normal route. That's normal symptoms to have. And you're saying, I can't go on like this. I'm still having these symptoms. This is an actual problem. Something must be done. This is why, okay? When you go to a standard lab facility, for example, if you go to your local blood testing facility and you get your blood tested that day, what's actually happening is you're getting your blood tested and you're going to get compared against every person who has been in that lab in the past year, okay? So now the question is, who goes and gets their labs or blood work checked on a weekly, monthly, yearly basis? Most of the time, healthy people are not getting their labs checked. Most of the time, sick people are getting their labs checked. As I mentioned, the United States makes up only 5% of the world's population. We're consuming almost 3/4 of the world's pharmaceutical medications, and we are a very sick country. So most people out there who are getting these labs done are not healthy. They are very sick. So now you're getting compared against that sick population. So what happens is these lab ranges have become over time very, very wide. very, very wide. Okay, so what happens is you get placed into this big pile of other people that you're compared against, and this produces a big bell curve. Okay, so it produces a big bell curve. You have 10% of the population on one end, 10% on the low end, 10% on the high end, and the rest of the population right in the middle. Now what happens is, again, because these labs use this standard reference ranges, the problem is that the standard reference range is based off of the general population. So years go by and actually these standard reference ranges get larger and larger and larger. And in addition, depending on your actual specific geographic location, these reference ranges can differ from place to place. So if you live in California, or if you live in New York, or you live in Texas, these reference ranges can be different from geographic location. So thereby you are getting placed in a even broader, potentially, standard reference range. Now, you're going to go to your doctor and they're going to use these reference ranges, which is why they're going to come back and they're going to tell you you're in the normal reference range. Everything is fine. Now, we don't use these standard reference ranges to determine the positives or negatives of your problem. We use what is called optimal or functional reference ranges. Now, I've not made these ranges up. These are made by the American Endocrine Society and the American Academy of Chemists. And these optimal ranges are based on healthy people populations. So a healthy population, which has no disease, no dysfunction, etc., and are much more specific and give us the opportunity and allow us to see a problem before it becomes an actual problem. Okay, so these optimal ranges allow us to see the yellow light before it is red. Okay. Now, here's a quick example of you go to your doctor and they say that your lab tests are all normal. As you can see in the second box here, we're looking at TSH. Now, the traditional reference range for TSH would be 0.3 to 5.7. Now, if you go to your doctor and you get this checked and you come at a 4.2, your doctor will say, well, you're in the normal reference range. Now, if you're using the functional or optimal ranges, which could be between 1.8 and 3.0, you are well outside that range. So while you may have thyroid symptoms with this marker here, you also may not have thyroid symptoms. And this is also the important point, that with these types of ranges, we can identify a problem before it becomes a problem. So some people have what's called subclinical thyroid conditions, or they don't have enough symptoms, excuse me, to bring them to the doctor. So their symptoms are not manifesting yet. But we know that symptoms don't correlate with the problem at hand. Most people have a lot of dysfunction for years and years and years before one day they say, wow, you know, I just noticed I'm losing my hair. I just noticed I'm getting tired. I just noticed my back hurts. I just noticed that XYZ. Because it's kind of like a tilting scale. These symptoms develop for years and years, and then one day it's a tipping point, and all of a sudden you develop symptoms. So here's a little schematic that you might be able to relate to. Again, good news, your test indicates that you're in the normal range, and you can see in this cartoon that the person is sitting there sick and tired, laying on the ground, and they're telling them that they're on the low normal range, except that there is in fact an absolute problem. Again, one of the patients that I had just a few months ago, she came to me and she said, you know, I've gone to my endocrinologist, I went to my primary care, I went to my OBGYN, I went to my another family physician that I was referred to, and guess what? Every one of them said that your lab ranges were normal. And not one of them came back and said, you know what, we have to check this marker, this marker, this marker. Now, she did some research, as many people do. As we mentioned, at least 35% of people self-diagnose or Google their symptoms. And she found out that there are other markers that can be done to give her more insight into why she was dealing with her condition. She brought these markers to her doctor and begged her doctor, please run these markers. Please Just do this for me. They wouldn't run the markers. She went to the nuts doctor. Please, out of desperation, run these markers. The next doctor finally ran 2 out of the 5 markers that she had found on her own. They came back positive, and the doctor then diagnosed her with Hashimoto's. Now, here's the problem. We're going to go over this. There's still the exact same medical intervention in the mainstream model of care for Hashimoto's as there is for low thyroid, which is medications. So if you're watching this and you see this cartoon and this relates to you, again, there's good news, and that is that there's a lot that can be done. And there are many people who have gone through your similar situation. So how do we determine your pattern and your problem? We determine this via the proper testing that needs to be done. Now, this can vary from person to person, and this is what we are able to find out in our consultations. Now, some of these laboratory tests may include a full thyroid panel. This is often the very first step. We have to know whether the antibodies or an autoimmune process is occurring first and foremost. Blood chemistry panels. Now, this is a comprehensive panel that includes many, many different markers. Next is a stool analysis testing for digestive function and GI infections or gut infections. Oftentimes, if there is a gut infection or infection elsewhere in the body, this is a problem, and we need to get to the root issue, because this is something that will fester over time. And over time, an infection can actually spur an autoimmune condition. We're going to go over some of these details a little bit later, but the fact is that there are many things that can spur or create the onset of an autoimmune condition. So if you have to think of it as if someone worked a 24-hour shift 3 out of 5 days of the week, or every single day out of the week, their body would not last. Over time, their body would just shut down. Within a week's time or less, much farther than that, their body would shut down and they would go to sleep. Their body cannot take that amount of stress. So if we have constant infections, if we have constant new environmental or food or chemical sensitivities, if we have constant nutrient deficiencies, if we have all of these different things that are impacting our lives, then this will actually increase the overall stress on the body. And at one point in time, the body will not be able to take any more stress. It is at this point that the body throws up the red flag and says, you know what? I'm going to start turning on the alarm, and I'm going to start notifying the body that there's a problem. So what starts happening now is the body starts attacking its own tissue. This is the body trying to tell you, hey, this is a problem. There's a problem here. Wake up. Okay, there's something that must be done about this. So these are some of the thyroid laboratory tests that help us determine what exactly is going on. What are the major triggers, and why is this thyroid condition developing into potentially an autoimmune condition? So stool testing, environmental sensitivity testing, food allergy and food sensitivity testing, nutrient deficiency testing, organic acid testing for energy production, heavy metal toxicity testing, genetic predisposition testing, saliva hormone testing, and more. Now, I'm going to go over this thyroid hormone pathway just to show you how in-depth the thyroid hormone pathway can get. And this is actually a condensed version. And this is just the thyroid hormone pathway, because this pathway will impact, as we said, all other body systems in the body. So we're going to start in the brain at the hypothalamus. Now, the hypothalamus sends what's called thyroid-releasing hormone to the pituitary gland. Now, the pituitary gland sends thyroid-stimulating hormone, a marker that you may have gotten wrong, to the thyroid. That's one marker. Now, thyroid-stimulating hormone stimulates what's known as TPO, or thyroid peroxidase, activity to use iodine and thyroglobulin to create T4 and T3. Now, an important point here is that T4 is the most abundant produced thyroid hormone in the body. Actually, 93% of all thyroid hormone is T4. However, T3 is the active one, and you only produce 7% of that. So we come to a crossroads. You have to convert this T4 into T3 in order to make this active. So now what happens is these thyroid hormones jump on, we could call it a taxi cab around the body, called thyroid binding globulin. And now this starts to convert and gets delivered in the liver, the gut, and other cells in the body, in the periphery. And now 20% is converted to inactive or T4 or T3, which is known as reverse T3. Now, reverse T3 kind of puts us in the reverse gear. It takes us backwards. So as you get, we don't want to go backwards. We want to continue to go forwards. So T3, reverse T3 is inactive. We must test for this because reverse T3 can be elevated in different times of stress, infection, etc. Now, finally, T3 will enter the nucleus of every single cell in your body and starts to turn genes on and off just like a light switch in your home. So as you can see here, there's many other steps to this condensed thyroid hormone pathway that if we're just looking at TSH or just T4, we'll miss the entire pathway. In order to just get T3 into the nucleus and into the cell of every tissue in your body, you need a number of different nutrients. You need vitamins B6, a broad spectrum of B vitamins, zinc, magnesium, iodine, etc. Vitamin D, vitamin A. In order to convert T4 into T3, you need a host of other nutrients. And in order for all of these systems to be working properly, you have to have adequate exposure, adequate stimulation, and adequate synergistic working processes with these other processes in the body. Now again, the hypothalamus is kind of the central control tower of all hormones in the body. So you have the hypothalamic pituitary thyroid system. You have the hypothalamic pituitary adrenal system. You have the hypothalamic pituitary gonadal system, and so on and so forth. And each of these axis systems work perfectly in tandem. So we cannot just look at TSH or T4 of the thyroid, diagnose your thyroid condition, and then give you medication to treat your thyroid condition. Because your thyroid condition could be a direct result of the thyroid pituitary adrenal axis system not working properly. The hypothalamic pituitary adrenal axis system not working properly, creating excess cortisol and stress response in the body, and thereby blocking thyroid hormone production. There's a million ways that this system can go wrong, which again is why a personalized approach, a unique approach, specifically catered to your specific instance and condition is what needs to be done. So again, how many markers is your doctor running? If they're only running TSH, this is the gold standard in the traditional or mainstream model of care, they're only going to get what TSH is telling you. And if it's too high, you're going to be diagnosed with hypothyroidism. If it's too low, you're going to be diagnosed with hypothyroidism. But as we discussed, this is not always true. If you have an autoimmune thyroid, TSH can wildly fluctuate. So here are some of the thyroid markers that we run. Again, this is just for the thyroid, TSH, free, T4, total T3, T4, reverse T3, T3 uptake, and the antibodies. Now the antibodies are really what tell you, is there an autoimmune process occurring? This is very important. As we mentioned, over 90%, at least 90% of all thyroid conditions in the United States are due to the autoimmune process. And these markers are often never even run. And this is why people take medication for years and years and years before finally they are fed up and they throw the towel in and they are so frustrated with their doctor and they say, I want you, please run these markers. Just like I told you in the story about one of my other patients. So as we discussed, the thyroid is impacted by so many other hormones and markers in the body, including cortisol, which is your major stress hormone. Now, let me give you a quick analogy. If you were on a hike and you saw a bear in the woods, or maybe you're in the ocean and you saw a shark, what's going to happen is your body is going to go in what's called fight or flight mode. Now, fight or flight mode means that your body is going to increase its sympathetic nervous system through the roof. You're either going to get ready to fight or run if you can from that predator. Now, this is an inborn mechanism into our bodies that has been used by us for years and decades and millennia that allow us to get away from predators. Cortisol is one of these hormones that becomes highly elevated in these times of high stress situations, such as seeing a bear or seeing a shark. In addition, stress hormones and other hormones such as epinephrine or adrenaline start to increase in the body. Now, excess cortisol actually impacts and blocks thyroid hormone production. Now, you're not running from a bear every day or seeing a shark in the water every day. I understand that. But chronic stress, and especially in the high stress lifestyles that we all live in nowadays, with the excess exposure to stimulation of all sorts of different media and cell phones and internet and a million different things, this creates low-grade stress, which actually in turn rises and increases all of the time. So now you're not having a response to seeing a bear, but you're increasing this low-grade stress over time, which in turn will do the exact same thing. Sex hormones, progesterone, estrogen, testosterone, as we mentioned, these work with the thyroid as well. The thyroid directly correlates and works with these sex hormones. So again, low libido, not feeling like yourself, inability to infertility, painful periods, all of these other different things can be directly correlated back to the thyroid as well. Insulin, hemoglobin A1C, fasting blood glucose, all these other different blood sugar markers that we can use are again directly related to the thyroid. If you are not metabolizing properly, if you have poor metabolism, you are not going to be breaking down your food properly. You're not going to be breaking down your carbohydrates. You're not going to be breaking down your proteins. You're not going to be breaking down your fats properly. This creates a lot of problems in the body, as your hormones are made of proteins, your neurotransmitters are made of proteins. Many, many things in the body require these things. Your skin, your hair, your nails, everything is made up of protein. The thyroid, again, is directly impacted to this. Now, speaking of gut flora, nutritional deficiencies, and the like, again, when you don't have adequate gut exposure or gut acids or stomach and digestive enzymes due to poor metabolism, due to low thyroid function, you will not be breaking down these proteins. You will not be assimilating and creating a good environment for the gut bacteria, the gut microbiome. Now, there are over 138 medical published literature studies on PubMed, which is the largest database for medical literature and research. There's over 138 studies that relate the gut flora, gut microbiome to obesity, to weight gain. And what is correlated highly with the thyroid is the inability to lose weight, inability to decrease the weight. Again, highly correlated. Not only that, the gut flora creates about 80% of your immune system and is where about 72% of all of your neurotransmitters are produced. So when we change the entire environment in the gut due to a slower metabolism and the inability to break down our fats or carbs or proteins, resulting in nutritional deficiencies, this creates a host of other symptoms and other problems that, again, you go to your doctor and all they will say is, well, your TSH is this or your T4 is this. And they're not assessing any of these other issues that we're discussing here today. Liver enzymes, vitamin D, homocysteine and C-reactive protein, some of the major inflammatory markers we can look at in the body. Antioxidant and fatty acid status. This is, again, a huge component of overall health. We're able to assess your antioxidant status and fatty acid status, which really shows us the overall function of your cellular system. There is what's called telomeres in your body, and telomeres actually determine the length of your lifespan. They can tell us how long your cellular life will live, essentially. So we cannot necessarily lengthen the telomeres once they become shorter. So telomeres only shorten, but what we can do is limit the amount to which they shorten. And there's many different ways that we're able to, number one, assess this through the objective data, through the laboratory testing, and then get to a point where we are at a balance, a nice healthy balance, so that we can mitigate and minimize the amount of damage and oxidizing and aging that we do to ourselves. And then overall function in the gut and body immunity, as we mentioned. So This is the process, as I mentioned, on the exact strategy on how we're able to resolve and get to the root issue of these thyroid conditions and fix them without the use of medication or surgery. Comprehensive laboratory testing is the first step. Number two is healthy lifestyle choices. Again, this includes things like diet and nutrition, your environment, the water that you're drinking, the air that you're exposed to, the light that you're exposed to, any EMF frequencies that you're exposed to, and your mindset as well. Assessing all of these different components is what's going to truly get you the most optimal results going forth. And environmental inputs, again, all of these three parts is what truly can get you the healing that you need and that are looking for. Now, I want to discuss briefly what are barrier systems in the body. And this is actually where some of these autoimmune conditions such as Hashimoto's thyroiditis can actually develop from. Now, you have barrier systems everywhere in the body. With every breath of air that I take, with every bite of food that I take, I am actually consuming germs in the air, on our food, everywhere. And so I have barrier systems all over my body, as you do. The skin is a barrier system. For example, one of the biggest risks that someone has if they go into surgery or if they're getting a needle venipuncture is the risk of infection, because you are breaking the skin. And there are tons of bugs and bacteria all over your body. And so what can happen is when you break the skin, these can actually get into the wound and create a problem. So the skin is a barrier system. Your saliva contains a lot of antibacterial and different properties, immunoglobulins, etc., that actually protect you from the outside world. Your tonsils, if you've had your tonsils removed, that was actually a barrier system. Stomach acid is a barrier system. Your stomach acid actually has a pH of about 1. It's about 100,000 times more acidic than water. And yet your stomach acid is contained within your stomach, and it does not damage any other part of your digestive system or body. Even though if you put your finger into a bowl of stomach acid, it would be down to the bone in a matter of probably seconds. So it's another barrier system. Your gut flora, all of the microbiome, all these different bugs in your gut are barrier systems and protect you from the outside world. And again, your skin. So conditions like acne, eczema, psoriasis, cuts and burns. So you see, barrier systems protect you from the outside world. And when these barrier systems are actually compromised, you can start developing conditions, because now you have an entryway into your body to create a problem. Now, the largest barrier system is actually your digestive system. If we ironed out the digestive system, it could cover over 2 tennis courts. That surface area is enormous. And when we impact this and when we open up this barrier system, we gain an entryway into the immune system. As we said, about 80% of the immune system lies in the gut. So if we make way and we break that barrier system and something starts entering into it, this can start to mount immune response and create an overall problem in the body. So this is known as leaky gut syndrome or intestinal hyperpermeability. And this is actually degeneration of the lining of the digestive tract. So this increases the permeability for things to enter in, so such as toxins. And this creates an immune response. So things that the body that don't belong in the body basically are getting into easily. And this is creating the immune system become overworked. Now this can lead to poor digestion, leading to brain inflammation and poor body signaling and workings. And this is also because the gut and the brain work hand in hand. And this is called the gut-brain and brain-gut axis. And they are actually coordinated via the 10th cranial nerve called the vagus nerve, VAGUS, which controls many, many different processes in the body that you don't have to think about, such as heart rate, breathing, blood pressure, stomach acid production, etc., etc. So when we impact or influence this system in the body, we can create a lot of different problems. So as you can see, stress, toxins, food particles, drugs, pathogens, organ malfunction, this can all create gastrointestinal or digestive inflammation, leading to food intolerances, immune system issues, autoimmunity. I have some people that I've worked with that once we are able to assess and identify these environmental and nutritional food intolerances that they are having, and then we remove them, immediately, many of their symptoms go away. So this is a very important thing to understand, that while we want to get to the root issue, and we do, addressing some of these underlying issues can resolve your symptoms just as easily. So as we mentioned, 90% of all thyroid conditions, especially in the United States, are actually primary autoimmune conditions. This means the immune system is the true cause, the true culprit of the thyroid imbalance, and thus the immune system must be managed in order to get optimal thyroid relief. If the immune system is the problem and we're ignoring it, do you think it will be hard or easy to get better? Of course it will be hard. It's like ignoring the underlying causes. That's exactly what it is. So if you bump your knee, but you look at the shoulder saying, oh, it's probably the shoulder, even though you bumped your knee, and you're saying, hey, no, it's really my knee. I bumped my knee. Okay, that's what's going on, but you're still looking at the shoulder. You're going to ignore it completely. So this is exactly why we need to address the immune system, and doing these proper laboratory testing and getting to the root issue of this and creating a personalized approach and strategy for you going forward is exactly what can get to the root issue and fix this problem once and for all. You know, if you're watching this video, you're probably a bit like me, and you like to understand the why behind why you do things, and the what and the why in order for life to make sense. You know, it's very hard for us as humans to do something over and over again, especially if it doesn't make sense. And that's the whole point of this video, is to help you understand that there's so much that can be done and so many ways to resolve these things that actually make sense. Okay, it's not just throwing medication blindly at things and hoping that it will fix the problem, or hoping that it will change one marker on your laboratory test. These are things that will strategically improve your condition and fix it. So as we said, autoimmune conditions actually attack the body tissue that they're after. As you can see, you have Hashimoto's, multiple sclerosis, SLE or lupus, celiac disease, attacks the gut, eczema, psoriasis, rheumatoid arthritis, asthma. So the question is, what would trigger your immune system to form antibodies to your own tissues? If you're dealing with the Hashimoto's condition, you might be wondering, but why did it happen to me? And here are some of these reasons. And again, this is why we have to address this from a very personalized and individualized approach. As we mentioned, poor barrier system, inflammatory diet, poor detoxification systems, food sensitivities or allergies, environmental or chemical sensitivities, chronic infections, whether they're in the gut or elsewhere in the body, poor thyroid function, poor adrenal function, poor immunity overall in the body and in the gut, pregnancy. You know, I have so many people and patients that come to me and they tell me, yeah, Dr. Anthony, you know, I had my first child. I felt fine. No symptoms, no problems. Had my second child. Felt fine again. After my third child, just weeks after my third child, I got my symptoms. I got all these different symptoms out of nowhere. Pregnancy is a major stress on the body. And postpartum depression and all these other things are real conditions and situations that we have to address accordingly. Again, all these different conditions could be caused by a number of things, which is why we start with the specific and proper laboratory testing to begin with. So you may not have had a problem after your first pregnancy. Maybe it was the third, or maybe it was the first pregnancy. Maybe it was during the first pregnancy, or it was after the first pregnancy. You know that there are massive fluctuation in hormones before, while, and during pregnancy. So this is, again, a major stress on the body that we need to, number one, prepare for, and then number one, act accordingly for it. Certain nutritional deficiencies, again, poor brain function, and even psychological stress. If you are dealing with a loved one, a family member, a friend, a coworker, work in general, a job, it could be any type of psychological stress. It could be working out too much. It could be all these different things. And that is creating your problem. This can stimulate the immune system and cause you to develop an autoimmune condition. So we have to assess all of these different things in order to get to the root issue. and find out what those triggers might be for you. So if you're constantly having flare-ups, maybe you're feeling good, but then you have a flare-up, and you feel good, then you have a flare-up. We have to identify these things so that you are feeling better and can put your condition into remission. So traditional medicine has been treating thyroid conditions the same for over 40 years. And that is for hypothyroid, synthroid, or levothyroxine. For hyperthyroid or Graves, more medications, methimazole, surgical removal, radiation. Hashimoto's, immunosuppressants. Pharmaceutically based to manage symptoms only. Again, all you have to do is turn on your TV, and every other commercial is one for a pharmaceutical drug. Now again, there are times when pharmaceuticals have their time and place. Yes, they can be absolutely fantastic interventions. But applying this exact same strategy to every single person, this cookie cutter approach, is why there are so many people still suffering and so many people with other chronic diseases that don't have answers and are frustrated and tired with the same old model. Now, again, on the other hand, we find the underlying cause through a functional or modern approach to this. We get to the underlying issue through proper testing, managing and removing the true underlying triggers. Again, some of those that we just went over: inflammation, food sensitivities, hormone imbalances, etc. Identifying heavy metals, gut infections, nutrient deficiencies, and utilizing therapies and remedies that work with the body. Everything that we do has zero side effects. There are no side effects. There are no nutrient depletions. Okay, look on the back, and there is a chart through the American Academy of Family Physicians that you can find that will show you pharmaceuticals and the specific number one side effects, and number two, the specific nutrients that they deplete in the body. It is actually almost rare to find even a single pharmaceutical medication that won't deplete nutrients in the body, vitamins, minerals, other nutrients, etc. This is the exact same reason why if someone is suffering from depression, say for example, from thyroid conditions, and they go to their doctor will diagnose them with a depression and then give them an antidepressant. But one of the underlying triggers or causes for depression can be a vitamin B6 shortage, which is the precursor to serotonin production. And we know that if you have low serotonin, that you can have and develop depression. And one of the nutrient depletions of these antidepressants is vitamin B6. So now you go to your doctor and you potentially had a vitamin B6 shortage, which is very common, causing your depression, amongst other things. And now they give you an antidepressant, which further depletes, further digs your hole of this depression and does not even get close to the underlying issue. So again, traditional treatment, synthetic thyroid hormones. Levoxyl, there's different types of the thyroid hormones that you can be prescribed, whether they're synthetic or bioidentical. Some are T3 only, some are T4 only, some are combination. Some are bioidentical, meaning they're coming from different animals that potentially work with the body a little bit more. They're combinations. But again, even these can have different variations and different compounds and concentrations of these hormones. And then further, you can even sometimes have medication from a compounding pharmacy with very specific concoctions of these T4, T4, 3, T4 combinations. Again, this is still the traditional treatment, just medication, not addressing any of these things what we're going over today. So sometimes the first treatment is anti-inflammatory medication. These are some of the side effects of anti-inflammatories, such as corticosteroids, prednisone, budesonide, Entocort. These are the side effects of corticosteroids. So we all know somebody who has gotten an injection in their hip, right? Maybe they got a steroid injection for whatever it might be. And this is what actually causes this, okay? And over time, if you continue to get these corticosteroid injections, these are the side effects: increased risk of infection, low thyroid function, thinning of bone, fractures, leaky gut, suppressed adrenal glands. This is because corticosteroids are at least 10 times stronger than your natural production, body production of cortisol. So corticosteroids is synthetic cortisol, which is 10 times stronger than your body's natural production of cortisol. So when you increase synthetically this type of situation, you suppress your natural body's ability to produce cortisol, which can create all of these other issues. Okay, high blood sugar, cataracts, memory, weight gain, hypertension, fluid retention. More drugs would be the next step in this process. Again, here are some more of the side effects. Okay, and then finally, immunosuppressants. Now, this is specifically for an autoimmune condition. And I've worked with many people who have taken immunosuppressants, such as Humira, Remicade, methotrexate, etc. But when you suppress the immune system, you're not able to use the immune system. And your immune system is what protects you from infections, which is overgrowth of bugs and bacteria, and cancer. Now, cancer is just the unregulated or uncontrolled replication of cells. Now, on a daily basis, your immune system controls that. It keeps it in very tight control and regulation. But when you suppress the immune system in hopes of calming down the overall autoimmune reaction, you create these potential side effects. And again, what do all of these have in common? What do all of these have in common? They only treat the symptoms and not the underlying causes. They don't address and aren't designed to get to the root issue of the autoimmune or thyroid condition. So, what makes us unique? What makes my process so unique? The extensive laboratory that we utilize to find your thyroid pattern and your underlying causes is one of the major issues. Then once we address that and know that information, applying the correct strategies for you specifically going forward to not only improve your symptoms, but also fix the underlying dysfunction is what truly makes this process unique and truly gets us the answers that you're looking for. So we utilize these natural therapies that work with your body. So again, thyroid tests and different testing can vary from person to person depending on your history. However, these are some of the major ones that you often want to have done. As we mentioned, full thyroid panel, a full blood chemistry panel, a stool test to analyze for digestive function and gut infections, environmental, food, and allergy sensitivity testing, organic acid testing for energy production, looking at the cellular level, how things are working in the body, nutrient deficiency testing, genetic predisposition testing, and saliva or even urine hormone testing. So, what are your next steps? If this video presentation made sense to you, I encourage you to schedule a complimentary health strategy session with myself. In that session, we're going to be going over a number of different things, but truly trying to understand what might be going on in your own body, and then addressing that going forth. So the process that I take for each person that I work with is on the first visit, after our strategy call, we will go over a comprehensive case review where we're going to dive deep into your history, your goals, your concerns, and your signs and symptoms, and how we can get to the root issues of those. You'll complete an initial health intake, and you'll provide any previous laboratory tests or procedure results that you may have had done in the past. This can include laboratory tests, ultrasounds, and anything of the sort. And on the second visit, we will follow up, in which we're going to go over the findings of your comprehensive case review, initial intake forms, and any previous laboratory tests or procedures that you had done. And then what we'll do is we'll make any recommendations for the functional laboratory testing that you can either perform on your own or with us. So this process requires a commitment. I only work with a select amount of people per month because this requires a lot of commitment on my part and a lot of strategic investment. So I only accept a certain amount of people. And so the people that I work with must be committed to making these life changes. Now, we're not going to make you, bend over backwards to do a million things, but there are certain things that once we are able to identify, that I will address you and let you know that these are the strategies that you're going to want to take in order to improve and get better. In addition, there's a time commitment to this. We want you to get better. And there's no way that you are going to get better with one visit. You know, the standard doctor's visit nowadays, which is documented in the literature, is about 5 to 8 minutes long. 5 to 8 minutes long, and then you get a medication, and then they send you on your way. There's no way for someone to get to the underlying issues and to know what to do specifically for you in 5 to 8 minutes. So we will meet periodically, relatively in strategic times, so that we can stay on top of your progress and make sure that we're making the strategic advances that we want to for you. So I want you to answer these questions and ask yourself these questions. So I hope you enjoyed this video, and you know, I want to know if your thyroid condition is preventing you from living your life. I told you the story about one of my patients, and this is very common, and she couldn't go out with her friends. She couldn't have any fun. She couldn't even have a drink on the weekends because she would have such bad fatigue. She couldn't go on vacations. She had been to these top respectable hospitals and medical clinics, and she was so fed up. She was absolutely fed up. It was affecting her relationships with her family, with her spouse, with her friends. She couldn't enjoy life. So if this is impacting you and it's not, and your current treatment is not working for you, I want to let you know there's hope. But again, you have to have hope in addition to a strategic plan in order to get resolution. So I hope you enjoyed this video again. Thank you so much for watching. Congratulations, you watched the entire webinar from beginning to end. Now, the definition of insanity is doing the same thing over and over and expecting a different result. So if you are tired of not having answers to your thyroid condition, tired of losing your hair and gaining weight, tired of the nagging fatigue and constant colds, tired of taking medication after medication, tired of doctors not listening to you, and tired of struggling with no resolution in sight, then I encourage you to schedule a discovery call with myself today so that we can dive deeper into your thyroid condition and help you resolve it once and for all. Now, the great news is we've helped dozens of patients who are in your shoes before, and we know exactly how you are feeling. Many of my clients and patients have been to highly respectable medical clinics and hospitals, gotten hundreds of medical procedures and tests done, and spent tens of thousands of dollars, and yet still were suffering and didn't have answers, just like you. Once they worked with us, we were able to finally provide them with the answers and solutions to their thyroid condition. So thank you for taking the time to watch this presentation, and I look forward to speaking with you soon.